My name's Rachel. Welcome to Hall Health Center. This film will tell you about the services at Hall Health Center, which are designed to help you stay healthy and in class. Over the next few minutes, you'll be seeing a depiction of common physical and mental health issues that face UW students and how Hall Health Center can help you get better. All scenes with students involve real UW students who are Wellness Resource Center volunteers, and those with staff are real Hall Health Center employees.
Hey, you don't sound so good.
I don't feel very good either.
Do you want to go to Hall Health?
Man, I don't want to go anywhere.
You know, you could call them for free and talk to a nurse.
You can?
Yeah, let me look that up for you.
Alright.
Along with tuition, you will also pay a services and activity fee, which gives you several prepaid services at Hall Health Center. This includes a student calling a Hall Health Center consulting nurse to get health advice.
Hi, this is Ruth. I'm one of the consulting nurses.
Hi, I was told that if I called I could get a consultation over the phone.
Okay, so tell me what's going on.
Alright, cool. Well, I've been feeling really sore in my throat for the past few days. Hurts extra bad when I swallow. And I feel really hot and lightheaded. I think that may be because I'm dehydrated, though.
Okay. You know, it sounds like we should probably take a look and see what's going on. As a student, you are able to come in to see the consulting nurses as often as you like. And so we have walk-in availability. So whenever it's convenient for you, if you want to just walk in to see the consulting nurses, and we'll take a look and see if we need to do a strep test or have you see a provider, okay?
Okay, thank you.
Another prepaid service through the SAF fee is an in-person visit with a consulting nurse. Students can use this via a drop-in basis during Hall Health Center's regular hours of operation.
Hi there, checking in for an appointment?
Yeah, I made a phone call earlier today, and I don't think I have an appointment, though.
Okay, did you speak to a nurse?
Yes.
Okay, may I have your Husky card?
Yeah.
When you come in to see someone at Hall Health Center, it's very important to bring your student ID and any insurance information you may have.
And so you're all checked in to see the consulting nurse. Just go ahead and take a seat behind you there and listen for your name to be called.
Alright, thank you.
You're welcome.
My name is Ruth. I'm one of the nurses. And so what's going on for you today?
My throat's been really hurting me the past few days, especially when I swallow, so I can't really eat that much.
Okay.
I've been feeling a bit hot and kind of tired, but I just think that's because of dehydration.
Okay, all right. So when you say a few days, how many days has that been?
I think this is the third. I mean,
Okay,
it may have been before, but it wasn't really bad.
okay. Well, let's go ahead and take a look and see what's going on in there, okay?
Okay.
Say, okay. Yeah, it looks kind of uncomfortable in there. So I think that probably we should go ahead and do a rapid strep test, okay? And I won't really do that. All right, so let's go ahead and get you on the schedule with the provider, okay?
All right.
Just look and see what we've got available today. So we are now about 20 past 8, so the next one I have available is 9:20. Does that time work for you, or do you have class?
That should work for me.
Okay. So let's go ahead and get you on the schedule, and I'll go ahead and get this over to the lab,
Okay.
and then we'll have that result by the time you see the doctor.
Okay. Thank you.
Another from the list of the prepaid SAF services is one visit with a doctor per quarter.
Hello, hi, you're Alex?
Yeah.
Hi, I'm Bill Neighbor.
Nice to meet you.
The doctor's here. I understand you came in with a sore throat,
Mm-hmm.
and you've also had a bit of a fever and felt like you've been a little bit dehydrated.
Mm-hmm.
Your strep test that the nurse ran did come back positive, so it does look like you have strep.
Mm-hmm.
Have you ever had strep before?
Yeah, a few times.
When was the last time that you had it?
Last time was probably 5th grade.
I'd like to ask you a few other symptom questions. Have you had a headache?
Yeah, a little bit of a headache. I
Okay.
always thought it was just due to lack of water, though.
No? Okay. And then how about a cough?
Yeah, I'm coughing.
Okay. What have you been coughing up?
Nothing weird.
So sort of clear, maybe just a little bit light yellow.
Yeah.
Okay. And then any nausea or vomiting, stomach pain,
No.
any diarrhea or change in your stools? No. And then your urination seems to be fine.
Mm-hmm. Yeah.
Okay. And then we always ask about travel outside of the United States or Canada. Have you had any travel in the last 3 to 4 months?
No.
Okay. because that would make us think of other things that might be involved. And then looking at your immunizations, it looks like those are up to date. Your last tetanus was within the last 5 years, so I think you're up to date on all of that. And then do you have any allergies to medications?
No.
Okay. So next I'd like to examine you briefly, and then we can talk about what we should do on the basis of what we find. So your examination showed that your ears look good, your nose looks fine. Your throat does show some pus on the tonsils. That could be due to a number of things, but the most common thing is strep, and your test was positive for strep. We do think about mono in college-age students, infectious mononucleosis that's due to a virus rather than a bacteria. But usually we find other enlarged lymph nodes when we examine you for that, and they didn't find any other enlarged lymph nodes. And then your lungs sounded completely clear. So I think that this is strep, and so we would treat you with a penicillin-like medication, and you're not allergic to anything.
Yeah.
So we'd give you, in this case, amoxicillin, and have you take that just twice a day. It's 875 milligrams, and you should take it for a full 10 days. Strep responds very quickly to antibiotics, so within a day or two you should feel much better.
Okay.
But you do want to complete the full course of the antibiotics in order to prevent recurrence of the strep or complications from the infection.
Okay.
Okay? Does that sound reasonable?
Yeah.
Good. And I'll send that prescription to Hall Health. Is that okay? To
Yeah,
the
sure,
pharmacy.
fine.
It's right on the right-hand side as you go out the building.
Okay. Thank you.
Okay, it's a pleasure to meet you,
You
Alex.
too.
Okay.
Hi. Hey, thanks for waiting. How can we help you?
My doctor sent in a prescription for me just a few minutes ago.
Oh, okay. They usually send it to an electronic folder, so let me get into that folder here.
Oh, okay.
And let's get your student ID card and insurance card as well.
Okay. There's my ID and insurance.
Yep, there it is. All right, Alex, what I see here is, looks like you got a minor infection. The doc sent it over an antibiotic for you. Let's briefly talk about this one. It's going to be 3 times a day. A nice thing about this one is you can take them with food or without, makes no difference.
Okay.
So very easy, just take a morning, mid-afternoon, and more of a nighttime dose for yourself. And take the full course of therapy. We want to get you well.
Okay.
Looking at it, the way you're talking, it sounds like probably a little sore throat,
Yeah.
strep throat going on.
Yeah.
Okay. Well, we'll get you in and out of here as quick as we can.
Okay.
So, any allergies to any medications right now?
No.
Good. Are you on any other medications at this point?
No.
Okay. Or do you have any chronic medical conditions, say asthma or diabetes or anything?
Nope.
Okay, good. This makes it very easy. Okay, thank you for your card. We're all set. Give me just a minute. I'll be right back with your meds, okay?
All right. Thank you.
Your insurance, ran it through your insurance. Wasn't too bad. It was $8 with your copay.
Okay.
So we'll have you just pay at the register.
All
while
right,
you're
thank
with.
you.
If you have any questions, you can always give us a call. Our number's right there.
All right. Thank
for
you.
us. Okay? Thanks. We'll see you again sometime.
Bye.
Hey,
Hey man, looking better.
thanks. I'm feeling better. That trip to Hall Health really worked. I was able to go to class again today, and now all I have to do is finish up my prescription, and then I'm all clear.
Maybe we should go to eat.
Yeah? Where are you thinking?
Let's go to the 8.
All right.
Hey, my name is Kalani Louie. I'm a senior here at UW. I study biochemistry and I'm a WRC volunteer.
Hi, my name is Alex Anderson. I'm a senior here at the University of Washington. I study public health, and I'm a volunteer at the Wellness Resource Center.